51. Which of the following is the primary goal of treating rosacea? A. Complete cure of the condition. B. Reduce the frequency and severity of flare-ups. C. Eliminate all skin redness permanently. D. Prevent the development of acne. Answer. B. Reduce the frequency and severity of flare-ups. Rationale. The goal of treatment is to manage and reduce the severity and frequency of flare-ups, as there is no known cure for rosacea. 52. What type of laser therapy is commonly used to treat visible blood vessels in rosacea? A. CO2 laser. B. Pulse dye laser. C. Fractional laser. D. And D. YAG laser. Answer. B. Pulse dye laser. Rationale. Pulse dye laser therapy is often used to treat visible blood vessels, telangiectasia, and redness associated with rosacea. Other types of lasers, such as CO2, are used for different skin conditions. 53. What should a nurse recommend to a patient with rosacea who has frequent flare-ups triggered by hot weather? A. Use topical steroids to reduce inflammation. B. Avoiding sun exposure and using a fan. C. Apply hot compresses to the face. D. Increase fluid intake to cool the skin. Answer. B. Avoiding sun exposure and using a fan. Rationale. Avoiding sun exposure and using a fan or cooling methods can help reduce rosacea flare-ups caused by heat. Hot compresses can worsen symptoms, and topical steroids should be avoided. 54. Which of the following medications may be prescribed for managing the pustules of rosacea? A. Topical clindamycin. B. Oral prednisone. C. Topical metronidazole. D. Oral antihistamines. Answer. A. Topical clindamycin. Rationale. Topical clindamycin is an antibiotic used to treat pustules and inflammation associated with rosacea. Oral prednisone and antihistamines are not typically used. 55. In which population is rosacea most commonly observed? A. Children under 10 years old. B. Adults aged 30 to 50, especially fair-skinned individuals. C. Adolescents with acne vulgaris. D. Older adults over 70 years old. Answer. B. Adults aged 30 to 50, especially fair-skinned individuals. Rationale. Rosacea is most common in adults aged 30 to 50, particularly those with fair skin. It rarely affects children or the elderly. 56. What is the impact of long-term use of topical corticosteroids on rosacea? A. Improvement of symptoms. B. Worsening of symptoms. C. No significant effect. D. Complete resolution of the condition. Answer. B. Worsening of symptoms. Rationale. Long-term use of topical corticosteroids can exacerbate rosacea symptoms, especially by triggering steroid-induced rosacea or causing skin thinning. 57. What is the appearance of the skin in the phymatous form of rosacea? A. Dry, flaky patches. B. Thicken, bumpy, and nodular. C. Blistering and peeling. D. Smooth and clear. Answer. B. Thicken, bumpy, and nodular. Rationale. Phymatous rosacea is characterized by thickening, bumpy, and nodular skin, often affecting the nose, rhinophyma. 58. Which of the following is a common mistake made when treating rosacea? A. Using a heavy moisturizer for hydration. B. Applying topical steroids for long periods. C. Avoiding sun exposure completely. D. Using non-comedogenic products. Answer. B. Applying topical steroids for long periods. Rationale. Prolonged use of topical steroids can worsen rosacea, a mistake commonly made when treating the condition. Avoiding sun exposure is recommended, and non-comedogenic products are appropriate. 59. What is the most common complaint of patients with ocular rosacea? A. Eye redness. B. Painful ulcers. C. Blurry vision. D. Dryness and irritation. Answer. D. Dryness and irritation. Rationale. Patients with ocular rosacea often complain of dryness, irritation, and a gritty feeling in their eyes. Eye redness can also be a symptom, but dryness is more common. 60. Which of the following conditions may exacerbate rosacea symptoms? A. Low humidity. B. Stress. C. Drinking water. D. Eating spicy foods. Answer: B. Stress. Rationale: stress is a common trigger for rosacea flare-ups, along with heat, alcohol, and spicy foods. Low humidity and drinking water generally do not exacerbate symptoms. 61. Which of the following conditions is often mistaken for rosacea due to its similar facial redness and pustules? A. Acne vulgaris. B. Psoriasis. C. Eczema. D. Lupus. Answer: A. Acne vulgaris. Rationale: acne vulgaris can cause facial redness and pustules, making it commonly mistaken for rosacea. However, rosacea typically involves more persistent redness and telangiectasia, while acne often involves comedones. 62. Which of the following is a common psychological impact of rosacea on patients? A. Severe depression due to visible facial changes. B. No psychological impact. C. Increased anxiety due to excessive sweating. D. Decreased social interactions due to symptoms. Answer: A. Severe depression due to visible facial changes. Rationale: the visible effects of rosacea, especially facial redness, can lead to significant psychological distress, including depression. It may also affect social interactions. 63. Which of the following is not a first-line treatment for rosacea? A. Oral doxycycline. B. Topical metronidazole. C. Oral isotretinoin. D. Topical azelaic acid. Answer: C. Oral isotretinoin. Rationale: oral isotretinoin is typically reserved for severe or treatment-resistant cases of rosacea. The other options, oral doxycycline, topical metronidazole, and topical azelaic acid, are considered first-line treatments. 64. What is the first step in managing a patient with newly diagnosed rosacea? A. Refer to a dermatologist for immediate treatment. B. Advise the patient to avoid triggers and begin topical treatment. C. Initiate systemic corticosteroids. D. Start systemic antibiotics. Answer: B. Advise the patient to avoid triggers and begin topical treatment. Rationale: initial management of rosacea involves educating the patient about avoiding known triggers and starting appropriate topical treatments like metronidazole or azelaic acid. 65. Which of the following is a recommended skincare practice for patients with rosacea? A. Use harsh scrubs to exfoliate the skin. B. Apply a thick layer of petroleum jelly to protect the skin. C. Use gentle, non-alcohol-based cleansers. D. Apply strong astringents to dry the skin. Answer: C. Use gentle, non-alcohol-based cleansers. Rationale: gentle, non-alcohol-based cleansers are recommended to avoid irritating the sensitive skin of patients with rosacea. Harsh scrubs and astringents can exacerbate symptoms. 66. What is the role of oral antibiotics in the treatment of rosacea? A. To cure the condition permanently. B. To reduce bacterial infection and control inflammation. C. To treat underlying fungal infections. D. To provide rapid relief of redness. Answer: B. To reduce bacterial infection and control inflammation. Rationale: oral antibiotics like doxycycline help control inflammation and reduce bacterial overgrowth associated with rosacea, particularly in more severe cases. They are not curative. 67. What is a common sign of ocular rosacea? A. Chronic conjunctivitis with discharge. B. Itchy, swollen eyelids. C. Decreased visual acuity. D. Burning and dryness in the eyes. Answer: D. Burning and dryness in the eyes. Rationale: ocular rosacea typically presents with symptoms such as burning, dryness, and irritation in the eyes, often accompanied by eyelid redness and inflammation. 68. Which of the following is an effective method of managing rhinophema, skin thickening on the nose, in rosacea? A. Use of oral isotretinoin. B. Topical corticosteroids. C. Cryotherapy. D. Daily exfoliation with a scrub. Answer: A. Use of oral isotretinoin. Rationale: oral isotretinoin is often used for severe cases of rhinophema to reduce skin thickening and improve the appearance of the nose. Topical corticosteroids and exfoliation are generally not effective for this condition. 69. Which of the following lifestyle changes is most beneficial in managing rosacea? A. Increased alcohol consumption. B. Smoking cessation. C. Avoiding daily sunscreen use. D. Increased exposure to sunlight. Answer: B. Smoking cessation. Rationale: smoking is a known trigger for rosacea and can exacerbate symptoms. Quitting smoking, along with avoiding triggers like sun exposure, is important in managing the condition. 70. Which of the following should be avoided by a patient with rosacea? A. Stress management techniques. B. Spicy foods. C. Use of sunscreen. D. Gentle skincare. Answer: B. Spicy foods. Rationale: spicy foods are a common trigger for rosacea flare-ups. Stress management, sunscreen use, and gentle skincare are recommended for managing the condition. 71. What is a key difference between rosacea and acne vulgaris? A. Rosacea is more likely to cause comedones. B. Rosacea typically affects the face only, while acne can affect other areas of the body. C. Rosacea is characterized by severe pustules and cysts. D. Rosacea is not associated with any skin redness. Answer: B. Rosacea typically affects the face only, while acne can affect other areas of the body. Rationale: rosacea is often limited to the face, with characteristic redness and telangiectasia, while acne can affect other areas of the body, such as the back and chest. 72. Which of the following medications is commonly prescribed to manage the papulopustular form of rosacea? A. Topical metronidazole. B. Oral isotretinoin. C. Topical corticosteroids. D. Oral antibiotics. Answer: A. Topical metronidazole. Rationale: topical metronidazole is commonly prescribed to treat the papulopustular form of rosacea due to its anti-inflammatory and antibacterial properties. 73. What is the primary purpose of using a laser treatment for rosacea? A. To eliminate the condition completely. B. To reduce visible blood vessels and redness. C. To reduce the size of the nose in rhinophyma. D. To cure the underlying infection. Answer: B. To reduce visible blood vessels and redness. Rationale: laser treatments, such as pulse dye laser, are used primarily to reduce visible blood vessels and redness in rosacea. They are not curative, but help manage the cosmetic aspects of the condition. 74. What is the primary symptom of phymatous rosacea? A. Frequent eye irritation. B. Skin thickening and nodular appearance. C. Erythema and facial flushing. D. Severe pustules and cysts. Answer: B. Skin thickening and nodular appearance. Rationale: phymatous rosacea is characterized by skin thickening and a nodular, bumpy appearance, often affecting the nose, rhinophyma. 75. Which of the following is an appropriate recommendation for a patient with rosacea during cold weather? A. Use hot compresses to warm the skin. B. Wear a scarf or face covering to protect from the cold. C. Expose the skin to the cold to reduce redness. D. Avoid moisturizing during winter. Answer: B. Wear a scarf or face covering to protect from the cold. Rationale: cold weather can trigger rosacea flare-ups, so it is recommended to wear a scarf or face covering to protect the skin. Hot compresses and avoiding moisturization can worsen symptoms. 76. What is the impact of rosacea on a patient's social life? A. No impact. It is a mild, non-visible condition. B. It can cause significant distress due to visible facial redness. C. It only affects patients who have severe acne. D. It typically leads to isolation due to painful symptoms. Answer: B. It can cause significant distress due to visible facial redness. Rationale: the visible facial redness of rosacea can cause social distress and lead to avoidance of social situations, affecting the patient's quality of life. 77. What is the recommended management strategy for rosacea in elderly patients? A. Oral isotretinoin as the first-line treatment. B. Use of non-irritating topical treatments like metronidazole. C. Use of high-potency topical corticosteroids. D. Complete avoidance of skincare products. Answer: B. Use of non-irritating topical treatments like metronidazole. Rationale: In elderly patients, non-irritating treatments like metronidazole are recommended due to their gentle nature and minimal side effects. High-potency steroids should be avoided due to potential skin thinning. 78. Which of the following should be recommended for a patient with ocular rosacea who complains of eye dryness? A. Use of eye drops containing preservatives. B. Regular use of a humidifier. C. Avoid all forms of eye lubrication. D. Use of hot compresses only. Answer: B. Regular use of a humidifier. Rationale: a humidifier helps maintain moisture in the air and alleviate dryness associated with ocular rosacea. Preservative-free eye drops may also be beneficial for lubrication. 79. Which of the following is a long-term complication of untreated or poorly managed rosacea? A. Permanent scarring. B. Cirrhosis of the liver. C. Vision loss from untreated ocular involvement. D. Systemic infections. Answer: C. Vision loss from untreated ocular involvement. Rationale: ocular rosacea can lead to long-term complications such as vision loss if left untreated. Scarring and systemic infections are not common complications of rosacea. 80. In addition to medical treatments, what lifestyle modification is important for patients with rosacea? A. Regular physical activity to improve skin health. B. High-fat diet to reduce inflammation. C. Avoidance of extreme temperatures. D. Increased alcohol consumption for relaxation. Answer: C. Avoidance of extreme temperatures. Rationale: extreme temperatures, both hot and cold, are common triggers for rosacea flare-ups. Managing temperature exposure is important for symptom control. 81. Which of the following is a typical trigger for rosacea flare-ups? A. Hot showers. B. Frequent exercise. C. Consuming dairy products. D. Drinking water. Answer: A. Hot showers. Rationale: hot showers or prolonged exposure to heat can trigger rosacea flare-ups. Other common triggers include sun exposure and spicy foods. 82. What is the primary cause of flushing and redness in rosacea? A. Increased production of melanin. B. Blood vessel dilation and inflammation. C. Bacterial overgrowth. D. Decreased skin hydration. Answer: B. Blood vessel dilation and inflammation. Rationale: rosacea is primarily caused by the dilation of blood vessels and inflammation, leading to the characteristic redness and flushing. 83. Which of the following is an important consideration when prescribing topical treatments for rosacea? A. These treatments are always safe for use during pregnancy. B. Topical treatments should be applied multiple times a day for the best results. C. Some topical treatments can cause skin irritation, so they should be used cautiously. D. Topical treatments should be discontinued immediately if any side effects occur. Answer: C. Some topical treatments can cause skin irritation, so they should be used cautiously. Rationale: topical treatments, such as metronidazole or azelaic acid, can sometimes irritate the skin, especially in sensitive individuals. It is important to monitor for irritation and adjust usage as needed. 84. Which of the following is an example of a systemic antibiotic commonly used for rosacea? A. Amoxicillin. B. Doxycycline. C. Fluconazole. D. Metronidazole. Answer: B. Doxycycline. Rationale: doxycycline is commonly prescribed for moderate to severe cases of rosacea to help control inflammation and bacterial overgrowth. 85. A patient with rosacea asks about the long-term effects of the condition. What is the best response? A. Rosacea can lead to permanent scarring if untreated. B. The condition usually resolves on its own without treatment. C. Rosacea is typically a temporary condition that doesn't cause lasting effects. D. With appropriate treatment, most symptoms can be managed and controlled. Answer: D. With appropriate treatment, most symptoms can be managed and controlled. Rationale: rosacea is a chronic condition, but with appropriate treatment, most symptoms can be effectively managed and controlled. Severe complications, like permanent scarring, are uncommon if treated early. 86. What is the role of lifestyle modification in the management of rosacea? A. Lifestyle changes have no effect on the condition. B. Lifestyle modifications, such as avoiding triggers, can significantly improve symptoms. C. Only prescription medications are effective in controlling rosacea. D. Lifestyle changes worsen the condition. Answer. B. Lifestyle modifications, such as avoiding triggers, can significantly improve symptoms. Rationale. Lifestyle modifications, including avoiding common triggers such as spicy foods, hot drinks, and stress, can significantly improve the symptoms of rosacea. 87. Which of the following is a key characteristic of rosacea that differentiates it from other skin conditions? A. Formation of comedones, blackheads, and whiteheads. B. Persistent redness, often with visible blood vessels. C. Dry, flaky skin with patches of scaling. D. Development of large cysts on the skin. Answer. B. Persistent redness, often with visible blood vessels. Rationale. The hallmark of rosacea is persistent facial redness, often accompanied by visible blood vessels, telangiectasia, distinguishing it from other conditions like acne. 88. Which of the following skincare products should be avoided by individuals with rosacea? A. Non-alcoholic, soothing moisturizers. B. Gentle facial cleansers. C. Products containing alcohol or fragrance. D. Sunscreen with SPF 30 or higher. Answer. C. Products containing alcohol or fragrance. Rationale. Products containing alcohol or fragrance can irritate the skin and exacerbate rosacea symptoms. It's best to use gentle, non-irritating skincare products. 89. Which of the following is most likely to trigger an exacerbation of rosacea symptoms? A. Applying cold compresses to the skin. B. Exposure to hot and windy weather. C. Taking prescribed antibiotics. D. Drinking plenty of water. Answer. B. Exposure to hot and windy weather. Rationale. Hot, windy weather can worsen rosacea symptoms, especially the redness and flushing. Cold compresses and adequate hydration are helpful in managing the condition. 90. What is the best description of the clinical course of rosacea? A. It is a self-limiting disease that resolves over time. B. It is a chronic condition with episodic flare-ups. C. It leads to widespread systemic effects. D. It is a highly contagious condition. Answer. B. It is a chronic condition with episodic flare-ups. Rationale. Rosacea is a chronic skin condition characterized by episodic flare-ups, often triggered by environmental or lifestyle factors. 91. What is the main purpose of laser therapy in the treatment of rosacea? A. To cure the condition permanently. B. To reduce inflammation and redness by targeting blood vessels. C. To remove excess facial hair associated with the condition. D. To eliminate the need for medications. Answer. B. To reduce inflammation and redness by targeting blood vessels. Rationale. Laser therapy, such as pulse dye laser, is used to reduce visible blood vessels and redness in rosacea. It does not cure the condition, but helps manage its appearance. 92. What is an appropriate recommendation for a patient with rosacea regarding sun protection? A. Use a sunscreen with an SPF of at least 15 daily. B. Avoid all exposure to sunlight. C. Sunscreen should only be applied during summer months. D. Tanning is recommended to help with rosacea symptoms. Answer. A. Use a sunscreen with an SPF of at least 15 daily. Rationale. Sun exposure is a common trigger for rosacea, so it is essential to use sunscreen with at least SPF 15 daily to protect the skin. 93. Which of the following is a complication of severe rosacea that requires referral to a specialist? A. Mild erythema and dryness. B. Rhinophyma, skin thickening on the nose. C. Occasional flushing after meals. D. Transient irritation after using skincare products. Answer. B. Rhinophyma, skin thickening on the nose. Rationale. Rhinophyma is a severe complication of rosacea that causes skin thickening and requires referral to a specialist for advanced treatment options, such as laser therapy or surgery. 94. Which of the following treatment options is typically used for patients with severe rosacea who have not responded to topical treatments? A. Oral antibiotics like doxycycline. B. Topical retinoids. C. Antihistamines for skin irritation. D. Oral corticosteroids for inflammation. Answer: A. Oral antibiotics like doxycycline. Rationale: oral antibiotics, such as doxycycline, are often used for severe or resistant cases of rosacea when topical treatments are not effective. 95. Which of the following factors can contribute to the development of rosacea? A. Frequent use of sunscreen. B. Family history of rosacea or sensitive skin. C. Prolonged exposure to cold temperatures. D. Low-fat, high-protein diet. Answer: B. Family history of rosacea or sensitive skin. Rationale: family history and sensitive skin are major risk factors for developing rosacea. While sunscreen use is protective, cold temperatures and diet are less significant factors. 96. Which of the following is a sign of ocular rosacea? A. Frequent bleeding from the eyes. B. Swollen, painful eyelids. C. Red, watery eyes and sensitivity to light. D. Dry skin around the eyes. Answer: C. Red, watery eyes and sensitivity to light. Rationale: ocular rosacea involves symptoms like red, watery eyes, sensitivity to light, and eyelid irritation. These symptoms can cause discomfort and require prompt treatment. 97. What is the primary goal of treatment for patients with rosacea? A. To cure the condition completely. B. To prevent flare-ups and manage symptoms. C. To reverse skin aging. D. To eliminate visible blood vessels permanently. Answer: B. To prevent flare-ups and manage symptoms. Rationale: the goal of treatment for rosacea is not to cure it, but to control flare-ups and manage symptoms like redness, irritation, and inflammation. 98. Which of the following is a key component of patient education for individuals with rosacea? A. Avoidance of all skincare products. B. The importance of daily sun protection. C. Use of harsh chemical peels to exfoliate skin. D. Regular application of high-strength topical steroids. Answer: B. The importance of daily sun protection. Rationale: sun exposure is a major trigger for rosacea, so patient education should emphasize the importance of daily sun protection to prevent flare-ups. 99. A patient with rosacea asks if they should stop using makeup. What is the best advice? A. Avoid all makeup to prevent further irritation. B. Use non-comedogenic and fragrance-free makeup products. C. Makeup should only be used during flare-ups. D. Use makeup only on the eyes and avoid the face. Answer: B. Use non-comedogenic and fragrance-free makeup products. Rationale: patients with rosacea can continue to use makeup, but they should choose non-comedogenic and fragrance-free products to avoid irritation and flare-ups. 100. Which of the following is the most appropriate action when a patient with rosacea reports worsening of symptoms despite following treatment recommendations? A. Discontinue all medications immediately. B. Increase the dose of topical corticosteroids. C. Refer the patient to a dermatologist for further evaluation. D. Advise the patient to stop using sunscreen. Answer: C. Refer the patient to a dermatologist for further evaluation. Rationale: if symptoms worsen despite following treatment recommendations, a referral to a dermatologist is appropriate for further evaluation and potential adjustments to the treatment plan.